How to find a therapist, Part 2, the action plan. Hello. I am Zainab. In this section, we will work on your action plan together. We will use a 7-step process to help you begin. If you don't have your action plan with you, follow along using a pen and paper. We will post the action plan questions at the end of each step. Before you look for your ideal therapist, it is helpful to clarify your reasons for seeking therapy and your expectations and hopes for the outcome. This can help you get the most out of therapy and find a therapist who specializes in your concern. What do you hope to achieve? What would success look like for you? Some people may hope to gain greater insight into themselves and their patterns of thinking and behavior. Others may hope to learn new coping skills to better manage their emotions and stress. It's important to be honest with yourself about what you want to get out of therapy and to communicate these goals to your therapist. Identifying your goals and expectations for therapy can help guide the therapy process and ensure that you and your therapist are working towards the same goals. It can also help you stay motivated and engaged in the therapy process, even when it may be challenging or uncomfortable at times.
Take a moment to pause this video and in your action plan, answer any one of the following questions. Why am I seeking therapy? What is the problem? What are my expectations for therapy?
Step 2. Once you've thought about what you want to achieve through therapy, the next step in finding the right therapist is getting a general idea of the different therapy techniques out there. You don't need to be an expert on which technique will work best for you, as the therapist will help you to determine this. They'll evaluate which technique suits you and how to use it effectively for your concerns. But having a basic understanding of the most commonly used modalities can help you make a smart choice. A therapy modality simply refers to the approach or method a therapist uses to treat mental health conditions or other issues. Each modality is based on theories that the therapist has studied, and they create a bunch of techniques and tools from those theories. For example, you might come across therapists who specialize in cognitive behavioral therapy, CBT. CBT is super popular and helps you change your thoughts, feelings, and behaviors. Reference your ideal therapist action plan for examples of techniques that CBT therapists use. Another common modality is psychodynamic theory, and therapists who are into that are called psychoanalysts. They dive into exploring unconscious processes, early childhood experiences, and the therapeutic relationship. There are other modalities too, like humanistic therapy, which is all about personal growth and self-awareness, or mindfulness-based therapies that use mindfulness practices to reduce stress and boost well-being. There's also family and couples therapies, such as emotionally focused therapy or the Gottman method, which focus on improving relationships and communication. Keep in mind that therapists often use a mix of different modalities based on their training and the needs of their clients. That's why it's important to talk to potential therapists about their approach and methods. You want to make sure they align with your goals and preferences.
Let's take a pause. In your action plan, answer the following. What type of therapy do I think I might need? Remember, you do not need to have the answers figured out yet. However, if you'd like to know more about the various types of therapies, we have provided some resources to help you.